here with Bennie Jeng. Bennie, you discussed compounding pharmacies and regulations, and let me ask you what the issues are. I mean, this is something that's been in the news, but I mean, clearly this is something that's relevant to our patients too, because some medications, at least in the U.S., have to be compounded.
So compounding therapy, as you know and as I talked about, has been around since the beginning of medicine because it's basically a way of getting medicines if you don't have mass production. And even now, there's a lot of medications where we might want to use different concentrations or different methods of delivery that might not be commercially available. It's especially true in ophthalmology. We use a lot of compounded medications for different things in all different fields. The retina people use it for their injectables. Cornea people use it for anything from dry eye to anti-infectives. We use fortified antibiotic drops all the time, and compounded antifungals, anti-amoebic drugs for dry eyes, and to make preservative-free drops, because now that everybody's using all these drops and there's toxicity, it's one way to get away from preservatives, but you had to compound it. And so the issue is with the recent outbreaks that have come around the last year that has drawn a lot of attention from the FDA, the government is interested in cracking down on it, and they're doing a lot of investigation. They're trying to pass laws that will restrict how compounding can be done. I fully agree, and I think most people fully agree, that we can't have lack of quality control, and there should be some measures by which compounded pharmacies have to meet the requirements so that patients are not put in danger. The problem is that in some respects and in some issues, the government is trying to create very high-level sweeping decisions about how regulations should be done. And for example, one thing would be that they would require a prescription for every patient for a compounded medication to be made. What that would mean is that offices that do emergency procedures using antibiotics, for example, can't keep them in their office because they wouldn't be able to be dispensed. And that would mean a delay in treatment for a patient, where a few hours can mean, no vision forever or vision and recovery. And so that's the main reason this has become a big issue in the public light.
How do you see this playing out?
I think that the reason that things haven't passed so quickly is because there's been a lot of lobbying to try to educate them that this is a patient care issue, that if they're too restrictive, then it will affect patient care. And again, I fully agree that there should be quality assurances for compounding pharmacies, and there are a lot of potentially dangerous things that could happen if we don't have this type of procedures in place. But I don't think that it should be restrictive that we are not able to take care of our patients in a timely manner.
Yeah, no, I mean, the concerns are easy to see on both ends. Yeah,
it all comes down to patient care, and we need to be allowed to continue to take care of our patients so that they can get better, and we can't have restrictions that'll stop us from doing that.
Yeah, vital stuff. Bennie, thank you very much for spending time with us today.
You're welcome.